Welcome to the University of South Florida. My name is Dr. Ed Funai, and I serve as the Chief Operating Officer and Vice President for Administration for USF Health in the University of South Florida. On behalf of the USF faculty, students, and staff, it is my pleasure to extend a warm welcome to our campus this morning to two very distinguished guests. Michael Smith, Special Assistant to the President of the United States, and the Honorable Bob Buckhorn, Mayor of the City of Tampa, and a true friend of and tireless advocate for this institution. We will have the opportunity to hear from each of these distinguished guests, as well as a few other speakers, in just a few moments. But before we do, it is my pleasure to make a few brief remarks about USF and why we are so excited about all the work our faculty and students do on this campus, as well as our other campuses in St. Petersburg and Sarasota, Manatee. USF is one of the leading public research universities, committed to helping those in our Tampa Bay community and beyond live healthy and productive lives. Our mission as a large public research institution serving one of America's largest metropolitan areas requires us to be an economic engine and a trusted resource for our region, our state, the nation, and the world. The program we are here to highlight today is a perfect example of the way in which we carry out that mission at USF each and every day. This September, for the second consecutive year, the United States Department of Health and Human Services recognized USF's commitment to these ideals and the incredible capabilities of our faculty, students, and staff by awarding USF the largest Navigator grant in the country. We could not be prouder of the tremendous talent and dedication of the grant's lead investigator, Jody Ray, and her team at the USF Florida Covering Kids and Families program. They work with partners across the state to assist Floridians in making informed choices about the health care insurance coverage that best meets the needs of themselves and their families. At this time, I'd like to invite Mayor Bob Buckhorn to the podium for some remarks on the significance of this initiative. Thank you.
Good morning. It's good to see everybody. I always enjoy doing these because I believe in this. I mean, you have seen the amazing results of the last two enrollments that we have been engaged in. I mean, over 1.7 million Floridians have signed up to get access to health care. And I can tell you as a mayor, there's probably not anything more important than the citizens that I represent having affordable access to health care. It makes such an amazing difference in the quality of their life. I mean, here in Hillsborough County, over 77,000 citizens, people that I represent, our friends, our neighbors, were able to acquire access to health care because of the Affordable Health Care Plan. This is not theoretical. This certainly is not partisan. This is an issue and a plan that has transformed and changed lives in immeasurable ways. And for us to now have the opportunity to once again partner with all of the people that you're going to see and hear from today, particularly the University of South Florida and the Navigators, to once again go out and make a difference in the lives of the people that we all serve, to get people signed up. I mean, you can't take for granted that people understand the process. You can't take for granted that they know the process. It takes navigators, it takes advocates, it takes healthcare providers, it takes Tampa Fire Rescue personnel who literally in the last process were handing out information to families that they would interact with who they knew didn't have healthcare coverage, to make sure that they knew what was available to them. It takes doing what we did the last time, opening up our parks and recreation centers to the most vulnerable populations, places where we had points of access, where we could touch people, where we could allow the navigators access to those populations to get people signed up. This is a program that makes a difference in the lives of people in this community in very real and tangible ways. So we're excited about it. We're going to put the full weight of our office behind it once again. We're going to use the amazing pulpit that I have been given by virtue of being the mayor to speak forcefully about this, to advocate on behalf of the navigators and the people that are out there signing people up, but most importantly to make people aware that this is an option that is available to them. This single program, I think more than anything that this administration has done, has the capacity to really impact people's lives in ways that we haven't even imagined. Access to affordable health care makes a difference, because I can tell you Absent this, the primary provider becomes the emergency room. And at that point, when they walk into the doors of that emergency room at St. Joe's or at Tampa General, at Florida Hospital, they are much further along in the disease than they would have been had they been given the opportunity for affordable health care at the beginning of it. So this really does make a difference. And ultimately, when it's all said and done, when they walk into that emergency room without health care insurance, you know who pays for it? All of us do. So it's far better that we get people covered. Get them access to great doctors and to great health care providers. Get them access in the beginning. Allow them to live healthy and productive lives. And the cost to us as taxpayers will diminish significantly. So we're all in. We're gonna jump in feet first like we've done before. And we're going to get as many people signed up as we can because it makes a difference in their lives. Thanks.
Good morning. Thank you, Mayor Buckhorn. My name is Michael Smith, Senior Director of Cabinet Affairs and Special Assistant to President Obama for My Brother's Keeper. I am thrilled to be here today representing the President of the United States and to bring greetings and gratitude on his behalf. You know, this is a really important time, and over the last 5 years, Tampa has had tireless advocates for quality, affordable health care, and with your support, we've been able to make incredible progress for the American people. I'm proud to lead the President's initiative that's really working to address persistent opportunity gaps facing boys and young men of color and making sure that all young people can reach their full potential no matter who they are and who they come from or where they come from. And since 2014, when the President launched My Brother's Keeper, we've seen some amazing progress across the country. We've seen more than 200 communities accept the President's My Brother's Keeper Community Challenge, including Mayor Buckhorn in the city of Tampa. We've seen more than $500 million in private sector investments really going to advance the goals of the work. And we've seen scores of new federal policy initiatives and grant programs and policy guidance. And the President is going to be in the Northeast today announcing some new exciting efforts as well. But you may be asking yourself, why is the person that runs the President's My Brother's Keeper initiative here to talk about open enrollment? Well, it's simple. You cannot talk about health care in this country without talking about serving what are some of our most vulnerable youth and communities. And we know that many of the uninsured and younger folks come from underserved communities, and we know that they're sometimes the hardest to reach people, 18 to 34, men, communities of color. And the data shows that African Americans, for instance, comprise almost 18% of the uninsured population eligible for coverage in states that use the federal health insurance marketplace, and 68% are persistently uninsured for 2 years or more. And they're worried about cost, and many don't know about or are confused about the financial assistance that's available. But we also know what a huge impact health insurance can make for a person and for a family. Health insurance is a huge part of financial stability. And in fact, before ACA, many of you know that the #1 cause of bankruptcy was medical bankruptcy. And thanks to new protections like preventative services at no extra cost, everyone's insurance is better off no matter where they buy it. So in terms of our target population, as you know, open enrollment started on November 1st and runs until the end of January. And it's going to be more challenging this year than it's been in past years. With historic gains in coverage and an improving economy, there are just fewer uninsured to enroll. That low-hanging fruit has already dropped. And so we're going to have to work even harder, and research tells us that. Ultimately, though, having fewer uninsured is a good problem to have, but it means we're going to have to work smarter and harder. And so I want to tell you a little bit about what we're doing. We're focused on putting the consumer at the center. First, we're making sure that folks know that the financial help is available to make coverage affordable to them. Second, we've made it easier to sign up in a number of ways. Third, there are people, as you can see here today, that are available to help here in Tampa and all across the country. And we have good data to back these up. Almost 8 in 10 of the uninsured people who can sign up for marketplace coverage have an income that qualifies them for financial assistance. And most people can find low premium plans for $75 or less per month. And we are always working hard to improve the consumer experiences with upgrades to our site and more tools to help people find what they're looking for. We want to make it easy as possible for families to find the right plan at the right price, and we're counting on the city of Tampa and everyone here to help us with that. And so we cannot thank everyone who's here today, to the USF community, to the navigators, for everything that they're doing to get folks enrolled. For social media, we're asking people to use hashtag #GetCovered. Join us on Twitter, Facebook, Instagram, and other social media platforms. I saw Mayor Buckhorn doing some selfies down there, so we'll do a lot of hashtag #GetCovered out there. Every tweet, post, and social media graphic makes a difference, especially as we work to reach younger audiences. So on behalf of President Obama, I want to say thank you for having me here today. I want to thank you for everything everyone in Tampa is doing to get Tampa and America covered. Thank you.
Thank you. I would like to thank Michael Smith and Mayor Buckhorn, as well as Dr. Funai, for taking time out of their busy schedules and joining us today at our Navigator Kickoff OE3 enrollment event here at the University of South Florida. We appreciate your leadership and unwavering commitment to getting individuals the health care coverage they not only need, but also deserve. I also need to recognize the Florida Covering Kids and Families team and the statewide Covering Florida Consortium that are working hard every day to assure that Florida families have health care coverage and are able to access quality health care services. 9.9 million consumers were enrolled nationwide during the second enrollment period, and almost 1.6 million of those were Floridians, far surpassing projection numbers. USF is extremely proud of the accomplishments achieved in years 1 and 2 of the Marketplace Initiative. Our reach this past year was far and wide, and nearly 200,000 individuals received one-on-one education and application assistance from USF project navigators, and almost 700,000 consumers reached through more than 3,600 community outreach activities across the state. Additionally, our combined marketing and communication efforts throughout the year had a reach of nearly 58 million. We are excited to participate in year 3, and this year USF and its 11 consortium partners will be on the ground providing outreach, education, and enrollment support to the entire state of Florida. We don't take a top-down approach, but rather one built and designed by the local communities being served. Yesterday began the third open enrollment period. We have a strong team of dedicated and committed partners throughout the state, and I have no doubt that we will again surpass enrollment projections. We are going to spread the message, help consumers get educated, and help people enroll into health care coverage. We only have 3 months to make an impact and getting individuals covered, so we are going to make it count. Next, I'm going to turn this over to one of our key partners in this effort, Ray Polk, Florida State Director of Enroll America.
Hi. I just drove in from Miami at 4 a.m., so I'm on a lot of coffee and Red Bull and 5-hour energy, so try to make this quick. Thank you. Good morning to everyone. Thank you to our partners, USF. Thank you to the White House, Department of Health and Human Services, and Mayor Buckhorn for having us here today. Thanks in part to all the hard work done by navigators. As many of the speakers here have said, over 1.5 million Floridians, which led the nation last year, have gotten covered, and over 150,000 right here in the Tampa Bay area. But there's still a lot of work to be done. There's a lot of remaining uninsured. What we know is that they tend to be younger. According to the Department of Health and Human Services, almost half of the eligible uninsured are between the ages of 18 and 34. We know that despite historic gains, Hispanic and African Americans are still more likely to be uninsured than their white counterparts. So we're focused on reaching those populations where they live with the information they need to get covered. The good news is that the remaining uninsured still want insurance. According to a recent poll, 7 out of 10 of the remaining uninsured said that it was important to them, but about half of the remaining uninsured still haven't visited www.getcoveredamerica.org or www.healthcare.gov. We must make sure that consumers are not only aware of financial help, but they also understand how it works to lower the cost of their plans. Our popular Get Covered America calculator, which can be found on getcoveredamerica.org/calculator, was a very useful tool last year, as well as our connector tool, which you can schedule yourselves with one of the wonderful USF navigators who are downstairs here today at today's enrollment event. Go on getcoveredamerica.org/calculator, type in your zip code, and down to the hour, you can schedule an appointment with a navigator in your area. And this goes throughout all 67 counties in Florida. In addition to reaching out to the uninsured, we'll also be encouraging the newly insured to check out the new options and actively shop on the marketplace before they renew, to make sure they're getting the plan that best suits their financial needs and their families. HSS recently reviewed some data showing that Floridians who changed plans when re-enrolling their coverage were saving close to $500 a year when renewing their plan. So even if you have insurance, you are automatically renewed, but Get Covered America, as well as USF, and everybody who is anybody talking about this issue is telling everybody, please make sure that you're going back into the marketplace. You might find a plan that's more affordable for you. The Get Covered, last thing, the Get Covered America website also has a plan selection tool, which will allow you to compare plans to make sure that they're fitting your financial needs as well before you actually schedule yourself with a navigator. So with tools like this, the hands of experts and navigators working for Florida Covering Kids and Families, as well as the Healthcare Family Foundation, I'm confident we will be able to make great strides in reaching these populations and making sure that everyone is aware that affordable, quality health care is available. And with that, I'd like to throw it to Melanie Hall. Thanks.
Good morning. I'm Melanie Hall, and I'm the Executive Director of the Family Healthcare Foundation here in Tampa. We are the lead organization for the USF project here in the Tampa Bay area. And so we actually provide that on-the-ground service for the counties of Hillsborough, Pasco, Pinellas, and Polk. So a fairly large geography here in Tampa Bay. And there's a lot of really good news to share this morning. First of all, Tampa was on the top 10 list of overall enrollment of cities in the country for 2015. That's exciting news and phenomenal in terms of the size of Tampa. So we're very, very proud of that. We're also proud to say that we were also in the top 10 list for Hispanic enrollment in the country. So there's been a lot of gains made here in the Tampa Bay area. The other piece of exciting information is that statewide, the insurance rates average for the marketplace plans only went up about 2%. When you think of the fact that for years and years, we saw double-digit increases in those plans, we can actually see that the law is beginning to work the way it's supposed to because it's starting to contain those costs. Here in the Tampa Bay area, our average rates actually went down 1.2%. So when you get enough people enrolled and you really spread out that risk pool, and people begin to use their health care the way it's intended, as Mayor Buckhorn talked about, not seeking primary care in our emergency departments, but actually getting preventive care, going to their doctors when they need to, accessing the services that they need when they need them, then the law really starts to make not only financial sense, but really starts to change the quality of people's lives. One of the things that Ray just talked about, though, is that we still have a lot of opportunity. And right now, about 30% of those that are uninsured here in Florida still are able to qualify for financial assistance. Again, get those plans. They're potentially $75 a month or less. So we still would like to count on each of you to help spread that message. The other piece is what you may have noticed is that Tampa did not make the top 10 list for the general enrollment for the African American population. So that is a challenge that I take personally and something that we are going to strive to really make some gains on here in the Open Enrollment 3. So in order to do that, we are participating in large-scale events like you see downstairs. You also may recognize that we're out in the community at those events specifically for special populations. Yesterday we were at Cogna Caliente with about 35,000 other people. It was a great event, and we were able to reach out again within that Hispanic population. But along with those large-scale events, we're also going to be going to individual churches and temples and mosques, because really you need to meet people where they live, where they worship, where they eat, where they go to school, in order to really make sure that we're giving everyone equal opportunity to gain access to this information. And finally, we really want to make sure we continue to lean on the leadership of some of the folks that have supported us tirelessly in the past, like Mayor Buckhorn, also Congresswoman Kathy Castor, other community leaders that have stepped up and made sure that they reached out to their constituents to provide that information, and make sure that we completely recognize the hard work of those navigators that you saw downstairs, some of which are also here in the room today, that really have given up their weekends, their evenings, to make sure that they're there to provide that one-on-one assistance, which we hear regularly is what helps people get enrolled. So thank you so much for your ability to help us get this message out. And I would like to now turn it over to someone who can tell a very personal story of what this means in terms of how it really is a life-changing event for folks that have access, sometimes for the first time, to affordable care. Thank you.
Good morning, everyone. My name is Samson Liu. I'm a 26-year-old USF medical student, and it's an honor to be here today. Thank you for having me here. I lost coverage 2 months ago because I turned 26, and at the end of that month, my mom informed me I didn't have health insurance. So I went 2 months without health insurance and then reached out to USF Health Navigators, and they were really able to help me and put 2 hours of their own time in to help me with the marketplace, help me through financial questions that I otherwise would not really have been able to answer on my own. So I'm truly appreciative of the fact that they took so much time and effort to get me enrolled, and also grateful for the Affordable Care Act and all the work that everyone else has done. So personally, for me, it's very meaningful to have health insurance. If something catastrophic happens for me, I don't want to be a financial burden on my family. I don't have many resources myself. So this is really important to me. And as Melanie mentioned, there's still a lot of work to be done. I have a lot of medical students who are very passionate. They go to a bunch of different volunteer events, and we are trying to be more helpful to the USF Health Navigators, and we would like for our health fairs to include some insurance information so that people who come to our health fairs will be able to get more information on how to get enrolled and how they can protect their health long term. So all in all, this has been a great experience for me, and continue doing everything that you guys do. It really means a lot to a lot of people, myself included. So thank you very much.
Good morning. My name is Cristina Calvillo Rivera, and I'm a campaign outreach manager with Young Invincibles, a national nonprofit research and advocacy organization committed to improving economic opportunities for young adults ages 18 to 34. Young Invincibles is excited and grateful to be joining the University of South Florida, Florida Covering Kids and Families, Enroll America, and the Family Healthcare Foundation for today's kickoff event for round 3 of open enrollment. Young Invincibles was initially founded under the motivation that young people's voices weren't being heard in the healthcare reform debate and the Affordable Care Act, one of the most pressing and economic and societal issues of our time. We knew that young adults were and still remain disproportionately uninsured as compared to other age groups. We still know that young adults end up in the emergency room more than any other age group, except for the elderly. We know that healthcare coverage is important to young adults and that they really, really do want it. 5 years after the ACA was written into law and 2 open enrollments later, young adults represent 46% of the newly insured population. The rate of uninsured young adult population dropped 5.2% from 22.4 to 17.2% nationally. That's twice as much as Americans 35 years of age and older, who saw a 2.7% reduction in the rate of uninsured. This means that there are 3.7 million fewer young adults who are uninsured today. These numbers are something to celebrate and give us new motivation going into Open Enrollment 3. We're also encouraged by the affordability of the plans on healthcare.gov. Most Americans can receive a plan for less than $100 a month, less than the cost of a cell phone plan. As we continue to enroll and educate thousands of young adults in Florida and across the country, we are also inspired and reminded why we do this work by the faces and voices behind those numbers, like Samson Liu. Thank you.